Hi, I'm Doug from the Wellness Dentistry Network, and I'm here this morning with Dr. Joel Kahn. And I want to remind our group that February is Heart Health Month. And not to mention, in our library, we have this heart measurables that matter. Display this in your office, have your patients ask you questions about it, and they might say something like, why is a dentist interested in heart disease? Well, what we know for sure is that we have tests that can look at certain oral pathogens, and these oral pathogens are significant in heart disease. So what we want to know is, do you have heart disease or not? Wouldn't it be cool if you could figure out your vascular age and see if it compares and how it compares to your chronological age? Well, I'm going to ask Dr. Joel about that because he has a really cool test called a carotid intima media thickness test. And that test will actually look at your age. It will give you an age of your arteries, and it will tell you whether you have any plaque in your arteries. Joel, what's the significance of that?
Yeah, well, it's pretty cool because 400 years ago, the most famous physician in England, Thomas Sydenham, MD, said, if you know the age of your arteries, you know the age of your body. And he picked that up from autopsy. Here we are 400 years later, and we have the technology, it's just not being used. And it's causing people to end up needing stents, emergency room bypass, heart attacks, and ultimately just dropping dead without warning. It's unacceptable. It's Heart Month. Pick it up early, like we talk about in every other disease state. We don't talk about it in heart disease. So you can do a 20-minute ultrasound. We're talking no radiation and no safety risk. And you can calculate that you're 50 years old, but your arteries are like a 42-year-old. You're in a good place, according to Dr. Sydenham. New data, old data.
Sure.
But if it says it's 64-year-old, because of thickening, because of plaque, we can, counsel a patient that we got to go deep on why, the root causes of why there's plaque early in life. We don't want to wait till you're in an emergency room. We want to know this 10 years ahead of time. And then we're going to institute nutrition, fitness, sleep, stress management. And there's an amazing array of both some prescription and actually natural supplements with human data. That stuff can go away. I see it in my clinic week after week. It goes away, but you have to work at it and pick it up early.
Great. Joel, can you actually help somebody from a distance? Let's say that somebody calls you on the phone because one of our network members might be in some other state and we might not be so approximated. Is that possible?
Yeah, it's gotten very easy to get advanced labs that are run through insurance out of state anywhere, and that's been a real advantage actually. Finding a quality CIMT center can be a little tough. The other tests that can be done, there is a heart CT scan that is widely available in every city in the United States. So between those two mechanisms, it's actually pretty easy to work from a distance. I work in Denmark and India and Israel and other patients all over. So
it's amazing.
It's very quantitative, very accurate, and it can be done at a distance.
Beautiful. I hope our members take advantage of these opportunities. Joel's in our library as one of our partners in health. Check it out. Hook up with a great cardiologist like Joel and help your patients and save their lives.